Hello, my name is Zack. I'd like to thank you for taking your time today to meet with me to go over my business plan for HC Consulting. During the next 10 minutes or so, we'll be looking at several key and important factors related to this business. But before we jump into the plan, let me tell you a little about myself. I received my Bachelor of Arts degree from the Evergreen State College and am currently completing my Master's of Science in Management at Troy University. I've worked in the healthcare industry for 23 years, and during that time I've worked in various capacities in several organizations. But for the last 16 years I've worked in financial decision support, 13 of those years with the major health system in the Seattle, Washington area, and the last 3 as a consultant in a consulting firm. I truly love the work. I don't have the fortitude to provide direct patient care, but I find real satisfaction helping organizations to make informed decisions about financial and operational improvements. This is my contribution to healthcare for patients in my community, nation, and the world. And while the old axiom is true, no margin, no mission, I know there are many ways to make a margin, including ways that maximize healthcare value to patients. HC Consulting will build on my education and experience. While it has some components of other healthcare consulting practices, I will bring new dimensions that will increase my competitive advantage. I truly believe that we are in the midst of a transformation in healthcare, one that will forever change its face. I want to seize on that transformation and help organizations make the most of it. These efforts will leave a lasting legacy and my imprint on time. The business plan is to create opportunities in 3 areas. First, basic consulting, providing resources to help healthcare organizations deal with constantly changing demands. This might be analytical services, accounting functions, decision support system management, or personnel management. In the midst of change, organizations routinely hire additional temporary resources to fill gaps. Second, research and synthesis of evolving trends, regulatory changes, and best practices. Analyzing various news and publications, we will find and package needed information. Then we will present those findings in various online media to which healthcare leaders will subscribe. Value to the consumer will be in concise, relevant, and timely information. And third, market the research findings to healthcare associations and vendors in the form of public speakers. These engagements would provide a source of income, but more importantly, expose HC Consulting to thought leaders as a valuable source of information. Each of the 3 areas would provide feedback to the others and provide an ongoing process of discovery and presentation. Organizationally, we will start with myself. As business expands, additional consultants and staff will be added. The organizational model will be very open and encourage critical input from all members. Initially, in-home offices will be established and maintained as long as the collaborative process can be accomplished. Collaboration will be the keystone to success. As work is performed or presented, consultants and staff will receive direct and indirect feedback. All of that goes back to the team to learn and provide new insights going forward. Constant critical and constructive input from all team members will be an expectation and help ensure that we deliver the very best products available. To promote collaboration, creative thinking, hard work, and exceptional customer relations, we will compensate at a higher level. This higher compensation will be results driven. Low performers will be mentored but excused quickly. With regards to the environment that HC Consulting will compete, externally, there are 4 areas that I feel will be most important. HC Consulting serves the healthcare industry. Healthcare is volatile and offers both opportunities and threats. I believe there are far more opportunities, not the least of which is the aging of America, the great baby boomers boom. The elderly, age 65 and over, made up around 13% of the U.S. population in 2002. But they consumed 36% of total U.S. personal healthcare expenses. Consider the volume of people moving into this demographic category. This is an abundant supply of services. Healthcare organizations will be on the constant lookout for new and better ways to serve these additional customers. Meanwhile, this will be a tremendous strain on the federal government as it works to keep Medicare a viable healthcare funding mechanism. We can see that Medicare will continue to consume a larger and larger portion of the gross domestic product. The federal government's current plan to extract more value from Medicare dollars will surely expand. This will create opportunities for our consulting group to help organizations maximize access to these diminishing funds. In addition to opportunities that the baby boomers present, the healthcare industry is highly regulated. Helping organizations understand the impact of changing regulations is a good source of information for HC Consulting to supply. Also, it's likely that healthcare will continue to experience a shortage of experienced labor resources. While most known for shortages in patient care resources, administrative and financial resources are also scarce. Finally, the industry is embarking on a new paradigm for providing services. What has been the practice of providing lots and lots of good services is shifting to providing the needed services for excellent outcomes. There is also a focus on community health as a component of providing that care. This shift will provide HC Consulting abundant opportunities to help organizations navigate for optimal results. Other external factors not related to healthcare include expanding technology and the consulting business itself. Technology will continue to evolve and enable research and delivery of information in new ways. HC Consulting will need to capitalize on these developments. The consulting business is divided into 3 tiers. The large firms are well established and provide services thought to have excellent integrity, but they charge premium rates. Medium-sized and small firms lack the immediate recognition but are more flexible. HC Consulting initially will be a small firm and will have to work hard to establish itself as responsive and of the highest integrity. In addition to the external environment, an internal assessment was made to acknowledge our strengths and weaknesses. The primary product from the firm is information. Data collected, analyzed, and assimilated is transformed into useful information. Therefore, it is important that the management structure and philosophy support a creative environment. The firm lacks a comprehensive marketing plan. Initially, I will employ an intuitive plan, but with the implementation of the business plan, the development of a marketing strategy is a must. The firm's greatest strength and weakness lie in its ability to provide new information to its clientele. Production of information is the result of analysis of healthcare industry data. Data will be collected from news, trade publication, and professional societies. Additional data will be collected during consulting engagements. Consultants will be recruited with specific skills in research, analysis, and presentation. As far as the management information system, customer relationship management software will be used to help consultants and staff collect and assimilate current and potential client contacts. The software will also associate specific research with clients to make connections between new product development and clients. A media management system will enable the firm to store, organize, and retrieve various content in multiple media. This system will be used in conjunction with its online presence to provide on-demand videos to clients. Trade organization presentations made by consultants will also be stored here for access and use. All blog and other written material will be categorized for easy reference. This is a summary of our analyses. You can see that our greatest strengths lie in our employee engagement and being centered on the healthcare industry. Our weaknesses are basically being a new business, small-sized, and also centered on the volatile healthcare industry. We explored some of the many opportunities like an expanding market and aging population, while our greatest threat is the uncertainty of the industry's revenues and how they may choose to spend them. As for our strategy, we will employ what Michael Porter termed Type 5, a best value strategy. This offers products or services to a small range of customers at the best price value available on the market. Product development is characterized by the very strengths of HC Consulting. Our next steps, should you elect to invest in our venture, would be to develop a web presence. This will be used to begin providing content. It will also give potential customers a place to express interest in our services and for HC Consulting to satisfy that interest and generate business. We would also engage a marketing firm to help us develop a comprehensive plan. This is a current weakness, and employing professional help will ensure our best chances for success. Finally, we would begin to establish a network. Word of mouth and personal connections will be our best bet for building a book of business. Miss Angel, if you elect to invest in HC Consulting, you will find an excellent steward of your money. This business is fueled by a passion and a strong belief in our ability to help build a stronger and more valuable healthcare system. It would be a viable business endeavor with strong social implications. Thank you and good day.